Hello. So in my previous video, I talked about the alarming rise of new cancer cases in our country. Now I will talk to you about 5 preventive strategies which are actually scientifically proven and doctor recommended to reduce your risk of developing cancers. Now, unlike hundreds of things which you might read on Google or social media promoting this diet fad, this miraculous herbal remedy for reducing the risk of developing cancer, this is actually what I'm about to tell now is actually scientifically proven and recommended by medical professionals to reduce your risk of developing different types of cancers. Number 1, avoid smoking and using tobacco products. You guessed it right. This habit alone contributes to almost 50% of all new cancers which happen in our country. Contrary to popular belief that smoking only causes lung cancers, cigarette smoke is known to have more than 70 to 80 types of carcinogens, which can cause the development of, or which can increase your risk of development of around 10 to 12 types of cancers, like cancers of the mouth, of the food pipe, that is the esophagus, breast cancers and cervical cancers in women, even liver cancers and kidney cancers also are here in, the risk is higher in people who have smoked cigarettes in their life. Number 2, avoiding alcohol intake. Alcohol is also categorized as a class 1 carcinogen because of the chemical acetaldehyde which is produced when alcohol is metabolized in your body. Consumption of alcohol is also linked to around 7 to 8 types of cancers in the body, that is breast cancers in women, then you have colon cancers in both the sexes, esophageal cancers, liver cancers and throat cancers. Number 3, HPV vaccination and hepatitis B vaccination. This is now routinely widely available in our country in all government and private hospitals. I will be talking about HPV vaccination in a subsequent video, so stay tuned for that. But as of now, what you should know is that these 2 vaccines can prevent the development of 2 types of cancers: HPV vaccination for cervical cancers and hepatitis B vaccination for the development of liver cancers. Number 4, those who are concerned about the risk of developing of breast cancer, it is recommended that you have your first childbirth as early as possible and you complete your family as early as possible, preferably before the age of 30. It is seen that women who postpone their first childbirth beyond the age of 30 to 35 are 3 to 4 times more likely to develop breast cancer as opposed to a woman who has had her first childbirth below the age of 20 years. So that is not to say that you have your first child very young, but you should not postpone it unnecessarily. And also breastfeed your children for the recommended duration by your gynecologist. We usually recommend at least 6 to 12 months of breastfeeding. All this reduces the risk of developing breast cancers. And finally, maintain your weight in the healthy range. For Indians, the recommended body mass index is 23 or below. This can be achieved by 2 methods. One is the proper diet and the number 2 is exercise. So limit your consumption of processed food items and high fat food items. Avoid sugar as much as possible. Consume a lot of fresh fruits and vegetables. And as far as exercise is concerned, it is recommended by WHO to engage in moderate intensity aerobic exercise for at least 150 minutes per week. So that basically boils down to 30 minutes of exercise for 5 days in a week, which is doable by the vast majority of us, but not all of us do it. So follow these 5 preventive strategies which I mentioned, and this will substantially reduce your risk of developing several different types of cancers in your lifetime. Thank you so much.